Hi, I'm Dr. Erik Wallin with Cullman Regional Urology Clinic, and we're going to talk to you today about male erectile dysfunction. Erectile dysfunction is a disease process that, in the general sense, entails problems achieving or maintaining an erection through the normal intercourse process. It is a very common issue among men, and among men aged 40 to 70, about half of those men are affected by erectile dysfunction for a various cause. And despite it being so common, it is a difficult point to bring up with your doctor. It's a very sensitive area, and only about 1 in 5 men will bring up this issue with their doctor. For that reason, in our clinic here at the Cullman Regional Urology Clinic, we use a survey that's very discreet and allows men to convey some of these symptoms so that we can bring it up in a discreet manner for the patient that's safe for them to discuss. Erectile dysfunction is caused, in a broad sense, by either problems with the vasculature down to the penis or with the neurologic signaling to the penis itself. And so the most common disease processes that affect a man and cause these issues are things like cardiovascular disease, obesity, diabetes. Certainly men who have spinal cord injuries and things like that are more likely to have erectile dysfunction. But even things that affect our ability to get into a mindset where we feel comfortable having an erection, like issues with depression and anxiety, can also contribute. I don't think it's ever too soon to be seen for a problem like erectile dysfunction. Any man at any age who's having difficulties either achieving initially or maintaining an erection should be seen by a physician. Now, general primary care physicians can handle some of the easy bread and butter type situations where it's just a simple medication thing. But especially for men who have failed other modalities, you're likely to end up seeing a urologist in the process who will deal with the more complicated. And when you come see your doctor for an evaluation of erectile dysfunction, you'll get a very general visit where we do a full history and physical. We want to know how long the process has been going on. We want to know what the other risk factors are for why this can be going on. And a key distinction to make is whether or not a man is having erections in the middle of the night, because that helps us differentiate problems with the components, the penis, the blood flow to the penis, versus more problems getting into the mindset, which is like more a psychogenic type erectile dysfunction. We do an exam to make sure the anatomy is appropriate, that all the parts are there, and we'll conclude with a plan that fits the patient's interests, as well as what we feel are safe options to start treating the disease. So one of the common misconceptions men have coming into my office about erectile issues is that it may have some sort of hormonal component like testosterone, and a lot of men will ask me if they should have their testosterone checked during the evaluation of erectile dysfunction. The issue here is that testosterone plays a role more so in a man's interest in sex, the libido a man has, whereas the process of erectile dysfunction is more driven by blood flow and neurologic components of the signaling of the erection. So testosterone is not routinely checked as part of the evaluation for erectile dysfunction, but can be an additional test we use if there are problems with a man's interest in sexual activity as well. So as far as treatment goes for male erectile dysfunction, we always take a stepwise approach. We want to start you with the safest option that helps achieve erections with minimal side effects, and then if we're failing to get good, consistent erections that last through sexual activity, we can always take a step up into a more aggressive treatment. Most men will start with what are called PDE5 inhibitors. That's your common oral medications, Cialis, Levitra, Viagra, and their generic components, sildenafil, tadalafil. Those are common medications most men have already taken before they come and see me. Most of these medications now are generic, which is helpful to get men these medicines, but we do also offer dosing through our urgent care pharmacy at a lower cost to men. And once those medications fail, whether it's because they fail to achieve consistent erections, or because there's an intolerable side effect, something along the lines of facial flushing, headaches, or visual or hearing problems, which are rare but can occur. We generally will start talking to men more about treatment options that directly affect the penis itself. And there are a couple options that fall into this category of treatments. Number one is what's called the vacuum erectile device, which is a pump essentially that fits over the penis, and we can use negative pressure to draw blood into the penis. And then a constriction ring is used to hold the blood there so that a man can achieve sexual intercourse in this way. And this is an excellent treatment option for men who have good use of their hands, who want to just purchase one device and not have to replace any sort of items. We teach men how to inject medication directly into the erectile bodies. And this is nice for men to be able to taper their own dose. It does require the man be capable of using a small gauge needle about the size of an insulin needle to inject a titrated medication directly into the penis. This is usually the most cost-effective way a man can consistently get erections. I mean, we use various compounding pharmacies to help get the medications to these men. We do teaching in our clinic on how to deliver this medication, as well as how to deliver rescue injections if the man gets an erection that lasts for 4 or more hours. Next up, we can use what are called intraurethral suppositories, a concentrated medication very similar to Viagra, Levitra, and those things, that's dispensed into the urethra and dissipates the medication out into the erectile bodies to help a man achieve an erection. And this can be a good option for men who are still looking for a medication and a less invasive process. The problem with this medication is it does go into the urethra, so it can cause some urinary symptoms. And then it still has to dissipate out into the erectile body, so it doesn't work for everyone. Once all of these options are attempted or fail, there's what's called an inflatable penile prosthesis, which is sort of the end-all, be-all in terms of erectile dysfunction treatment. And it is a surgical procedure where we use a prosthesis in place of the normal erectile bodies, which are placed surgically, as well as a pump and a reservoir that drives fluid from the reservoir into the erectile bodies through the use of a pump located in the scrotum that can produce a reliable erection to help men achieve sexual activity. The main risks of this is once you go to this treatment option, there's really no going back because you're eradicating the erectile bodies to place these devices. It is a foreign object, so it does have separate components that can individually fail. And then being a foreign object, there is a risk of infection. Anytime a device is placed, that it could have to be removed if the device became infected. But we offer all of these treatment options at Cullman Regional Urology Clinic, and I counsel men regularly on each of these.